Hi, I'm Lauren. I'll be your nurse today. You were probably given a sterile dressing kit for use at home for a dressing change. All of the products inside of the kit are similar to what I'll be using today. I'll describe the products that I'm using as we go.
Okay.
First, have a clean work area for all of your materials. Move away all clutter and wash the area with a disinfectant wipe. I'm going to do that for our area now. Good. Now our area is nice and clean. I'm going to make sure that my hands are clean and I'm going to sanitize them. Then I'm going to put on a clean pair of gloves.
Should I be wearing a mask doing this at home?
So you don't have to wear a mask while you're at home, but if you or if someone's helping you with this process at home, if either of you have respiratory symptoms, a cough or cold-like symptoms, then you should wear a mask.
Okay.
So first, if you don't mind, I'm going to have you hold your shirt a little for me, and we're going to take this old dressing off.
Should I do this in front of a mirror if I'm alone at home?
I think that's a great idea. If you have access to a mirror and a clean space, you can definitely do it in front of a mirror. So I'm sorry, I'm pulling at your skin a little bit, but we're going to take the old dressing off. As I'm taking the dressing off, I'm pulling the edges of the dressing toward the center so I don't accidentally pull on the catheter. You have a little patch on, and make sure that that patch comes off with the dressing. So now that we're done with taking the old dressing off, I want to wash my hands again and put on clean gloves now that I'm dealing with clean products. While I'm doing this, I want to view your catheter insertion site for any signs or symptoms of an infection. I'm looking for swelling, redness, any abnormal drainage. Yours looks wonderful, but make sure that when you do a dressing change at home, you're also inspecting for any signs of an infection.
Okay.
If you do have any signs of an infection, you should immediately call your healthcare team. To clean around the insertion site and the catheter, we use something called chlorhexidine. Chlorhexidine helps clean the area to prevent any infection. What I do is I break this and releases the liquid into the sponge. Make sure you don't touch the sponge to a surface because that makes the sponge dirty.
Okay.
Once it's fully saturated with the liquid, you want to scrub in an up and down motion around the insertion site and the catheter. This is very important to scrub for at least 30 seconds. Like I said before, it's better to scrub for longer than for not enough time. After I scrub, I want to ensure that the area is fully dry before I put a dressing on it. That creates that protection on the skin to help prevent an infection.
Okay.
You can count to 30 out loud. Make sure the skin does not appear wet anymore. Once the area is clean, it is important not to touch the area, especially where the catheter enters your skin. Just let the area air dry. Do not try to fan the area to speed up the process. Once that area is cleaned and scrubbed, it's very important not to touch it, okay? If I accidentally touch it now with my hands, I would want to re-scrub with a new chlorhexidine sponge.
When I was in the hospital, I had this white, almost like a patch. Do I need this?
Yes, so that's called a biopatch. If you do have that at home, I think you should use it. I'm going to use a biopatch today. It comes in a package like this. You can see that one side is white. The other side is blue with writing on it. The white side has chlorhexidine in it, just like the material I cleaned your skin with. It helps prevent an infection. You want that white portion of the biopatch touching your skin. We can apply that now. The white portion will face your skin, and you can put the slit around where the catheter is. Make sure that the biopatch is touching your skin. This helps prevent an infection. Okay. The last part is putting the dressing on to protect where the catheter enters your body. I'm going to remove the backing of the dressing, and you can use the tabs to hold on to. I'm going to remove the tabs so that the dressing sticks to your skin. And this brand of dressing has a plastic covering that you take off. So now you just have a clear, transparent tape over. This dressing also comes with little pieces of tape. We're going to apply tape to the bottom of the dressing to ensure that it doesn't pull up while you're at home. You'll put a piece of tape underneath the catheter to hold the side of the dressing down. Then you'll place a second piece of tape over the catheter to secure it in its spot. It's also really good practice to write the date and time that you did your dressing change. Like I said before, the dressing needs to be done at least every 7 days. So writing down the date and time is a nice way to remember. This comes with a piece of tape for you to do that, and then you can put the piece of tape over. So today is May 20th. This way, your healthcare team knows the last time the dressing was changed. Do you feel ready to do this at home, or do you have any further questions?
No, I think I'm all set. I think I can do this at home.
Wonderful. If you do have any trouble with the dressing sticking to your skin, or if it falls off faster than 7 days, please reach out to your care team for further instructions. It was wonderful seeing you. If you'd like, you can button up and you can head out.
Thank you.